this non-compliance. Current rabies vaccine are cell cultured vaccine. Inactivated vaccines are more than 50 years old technology. Inconsistency in potency, stability, availability, short supply, and adverse events. Can you please change the slide now? Compliance anti-rabies vaccine. Compliant is who received the full course of ARV, that is the scheduled dose of ARV on the recommended dates. Delayed compliance are who completed the scheduled dose of ARV within 60 days but deviated from the scheduled regimen. And dropouts and non-compliance are who had taken at least one dose of ARV after animal bite but not completed all the scheduled doses.
Next slide, please.
The limitations to 4-dose WHO recommendations are rabies post-exposure prophylaxis in routine practice in view of the new Centers for Disease Control and Prevention and New World Health Organization recommendations. A retrospective analysis done at Travel Clinic, a total of 100 patients who received rabies 4-dose PEP. Shortcomings in the management of these patients were late initiation of rabies PEP in travelers, administration of human rabies immunoglobulin. Antibodies were less than 0.5 ml in 6 out of 90 patients, that is 6.7% after 4 doses of vaccine. The conclusion part is patients do not always receive optimal rabies PEP under real life conditions. A significant proportion of patients did not develop adequate antibody levels after 4 doses of vaccines.
Next slide.
And the non-compliance to 5-dose proven cause of death.
Sorry for the interruption, ma'am. There is actually delay in the slide changing. I'm just sharing my the slide from my computer.
It's okay. It's okay.
Just sharing my slide. I'm just making that. So sorry for the interruption. Is it visible, ma'am?
Yes.
So we are at this slide, right?
There is a slide saying non-compliance to 5 doses which proven cause of death. Should I read out all, or you people can see it from here?
Just summarize the point, ma'am. That's all.
Okay. My goodness, it's not a space button. Actually, I'm taking the.
মেম দেখিবলৈ অসুবিধা হৈ আছে নেকি?
এটা হৈছে অকমান ঠিক আছে The age of the patient is 58 and a female patient. The nature of animal was street dog killed soon. Post-exposure prophylaxis were 3 doses given purified chick embryo cell vaccine Rabipur on the day of 0, 3, and 7. No rabies immunoglobulin. Chronology of events, clinical features were dog bite, category 3 at the right side of the nose, 20 days, paresthesia of face 20 days, fever and restlessness 5 days, altered sensorium since 1 day. The CSF findings were total cells 5, monomorphs 100%, protein 1 to 6, sugar 71, corresponding sugar 153, and negative staining. The diagnosis considered was rabies encephalitis. Confirmatory tests were rising serum and CSF virus neutralizing antibody titer of 1:8192 and 1:2048 respectively after 5 days of previous sample. The MRI findings were bilateral brainstem mild hypersensitivity without any restricted diffusion or contrast enhancement on day 2. The treatment given was modified Milwaukee protocol from day 1. The outcome was Her hospital survival of 16 days but died after 1 day due to lama. The second case was a 38 male. The nature of the animal was street dog, status unknown. Post-exposure prophylaxis was 3 doses given, vaccine type unknown, 037, no rabies immunoglobulin. Chronology of events were dog bite category 3, at left mid calf 15 days, dysphagia and restlessness 16 days. CSF findings are not done due to lama. Diagnosis considered was rabies encephalitis. Confirmatory test not done due to lama. MRI findings not done due to lama. Treatment given was supportive since protocol could not be started. The outcome was same, lama on the same day of the admission and death followed after 5 days. The third case was a 34-year male. The nature of animal was street dog, status unknown. Post-exposure prophylaxis was 3 doses vaccine type unknown, given on 0, 3 and 7 days, no rabies immunoglobulin. Chronology of events was dog bite category 3 at right dorsum foot 17 days, dysphagia and restlessness since 3 days and dyspnea. CSF findings were total cells 60, monomers 100%, protein 84, sugar 58, corresponding sugar 122, negative staining. Diagnosis considered was rabies encephalitis. Confirmatory test was rabies RNA PCR positive from CSF and serum but virus neutralizing antibody titer. MRI findings were not done due to early death. Treatment given was modified Milwaukee protocol from day 1. The patient expired on day 2 of admission. The reason of deaths may be due to lack of administration of rabies immunoglobulin or poor compliance to vaccination. The compliance to post-exposure prophylaxis among animal bite patients, a hospital-based epidemiological study at Safdarganj Hospital, New Delhi, and as you can see this circle showing 46%, 6%, and 48%. The blue indicates compliant, red indicates delayed compliant, and green indicates non-compliant. N is equal to 360 animal bite patients. A pre-designed, pre-tested structure questionnaire was administered by the interview technique. 53% were non-compliant to the full course of ARV. Compliance to anti-rabies vaccination in post-exposure prophylaxis. The graph has been shown here. At Municipal Corporation Hospitals, Bangalore, N is equal to 215 animal bite patients. 1 dose of rabies vaccine administered intramuscularly on the day of 0, 3, 7, 14, and 28 SPEP also measures constraints for compliance to complete course. The compliance rates for intramuscular rabies vaccination was 60%. Constraints for compliance to complete course of anti-rabies vaccine. It has been shown here. The major constraint for compliance to complete ARV was loss of wages 47%. The evolution of rabies vaccine. It is live in the nervous tissue. It is a two-type live attenuated vaccine. Spinal cord inactivated vaccine, brain up to 10%. And the cell culture is inactivated vaccination. Cell culture is 2.1 U. Non-standard dried preparation up to 31 injections of increasing immunogenicity. Minimal neural content liquid preparation 14 injections each 0.5 ml daily. Standardized immunogenicity lyophilized 5 injections 0.5 to 1 ml on the day of 0, 3, 7, 14 and 28. Non-compliance, meeting the unmet medical need, introducing a novel vaccine with simple and shorter regimen. Novel 3-dose recombinant rabies G protein vaccine. The first vaccine with 3-dose intramuscular regimen 0, 3 and 7 on the day of 0, 3 and 7. It is better compliance due to easy to flow regimen and less visits. Convenience, ready to use, no reconstitution needed. Prepared by VLP platform technology. And first protein subunit vaccine. Novel 3-dose recombinant rabies G protein vaccine. The VLP technology has been shown here. As G protein is difficult to stabilize, so G protein isolation using VLP technology is done, purified and stabilized by Cadila Pharmaceuticals Limited. Virus-like particles, VLPs, are protein complexes exist as nanoparticles. VLPs are similar to native virus particles, but that do not contain the viral genome. They cannot replicate, but can mimic the viral antigenicity without being pathogenic. They are capable of including a strong humoral and cellular immune response. The VLPs as vaccines. This is the clinical phase 2. Study has been shown here. Clinical study phase 3. Safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as simulated post-exposure immunization, a randomized comparator-controlled multicenter phase 3 clinical study. The phase 3 studies includes to evaluate immunogenicity and safety of rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteers. Randomized comparative controlled multicenter study. Total subjects included by 800. Randomization was 2:1. The TH rabies is given on a 037 days regime. 533 subjects included. And Revipure reference as 037, 14 and 28 days regime with 267 subjects. The results are efficacy. The results are consistent across different age groups and genders. Observed difference 1.52% with the pre-specified margin of -4%. Non-inferiority for sero protection primary endpoint day 14 and 42 were met. Test and comparator are identical in sero protection rate both on days 14 and 42. The study conclusion are novel 3-dose was non-inferior to reference vaccine, less adverse effects compared to reference vaccine. Novel 3-dose was found to be safe and immunogenic and was comparable to 5-dose of WHO pre-qualified vaccine. The awards are shown here. It has been awarded the Pharma Innovation of the Year by Economic Times, the Golden Globe Tiger Award Malaysia for Innovative Product of the Year. Thank you.
Thank you so much, ma'am, for your
Thank you.
valuable time. And sir, etu ma'am actually amar rabies vaccine to how to come 5 dose to 3 dose. Ei karone amar etu kora hoise. So ma'am, etu keneke bono hoise VLP technology keneke ki kora hoise mane keneke 5 dose or 3 dose leke ahil just kini etu bikhoye awareness er karone ami etu korisu ma'am. So thank you so much for your valuable time and valuable support. So jikini amar kotha hoise ekhine koi dibo ma'am.
Okay. Thank you.
Thank you ma'am. Have a nice day.
Thank you.